Do you know what's new for nurses? What about dementia and caregiving? Are you looking to grow as a leader? And what are the current healthcare leaders doing for you? Welcome to the Angie Graham Podcast. Welcome to the Angie Graham Podcast. Today, I'm super excited to talk about a topic. A few years ago, I seen a new clinic open in town, and I thought, what is this about? And people started telling me, yeah, it's a place you go, and they don't take insurance. And I thought, well, this is very interesting because I don't particularly like our health insurance anymore. Years ago, when I was still raising my children, you could take them to the doctor, and you had an HMO insurance, and you paid $30 on your visit, and everything else was taken care of. And since then, our whole world with health care has definitely changed. And as consumers, you start finding yourself looking for something different. And as I watched this clinic and checked out their website, and I heard a few people say really positive things, I made my own appointment. And so today I have with me Dr. Amy Doherty, who is running this clinic. It is named Claire Care here in our little town of Portage, Wisconsin. And upon my very first visit, I was like, why did you decide to do this? And we're going to get into that, but I want to give her some background of her education and where she has come from. She spent 8 years in medical training, then 10 years in traditional practice before deciding the system was not working for her or her patients. She has a BA in biology in Illinois in Wesleyan and a doctor of osteopathy, healthcare system that views the body as a connected whole from Des Moines University and completed family practice residency. She then went further and completed a second residency in orthopathic manipulation, earning board certification in both family practice and neuromusculoskeletal medicine. She trained under Dr. Edward Stiles, one of the leading osteopaths in the country, who learned directly from the family of the founder of the profession. After dedicating in full-time practice, she saw how limited the system was and pursued fundamental medicine training and started her own practice to actually give patients time, attention, and the care they deserve. Welcome, Dr. Doherty, to the show today. I'm super excited to talk about this topic.
Yeah, thank you.
So the big question, what made you decide to start a private pay clinic?
I decided that the most important thing that goes on in healthcare is the doctor-patient relationship, and the system that I was in was not helping out with that. The system, the insurance-based system, the doctor and the patient both start asking not what's best for the patient, but what does the insurance allow? So anytime you separate the people that are giving care and receiving care with a system like that, things are going to go south.
Agreed.
Yeah.
Very much agreed. I can say that my very first visit with you, I left there after 2 hours, and I'm like, I have never spent 2 hours with a doctor outside of giving birth. I was absolutely shocked, and I had a bit of that manipulation, and I stood up. I felt like I had a massage. Mm-hmm. I was like kind of in a daze. I'm like, I just had the most incredible doctor's appointment ever. Who says that? Who says that you just have the most incredible doctor's appointment ever? Most of the time you come home, was your doctor's appointment, and you realize you spent more time in the waiting room between the two waiting rooms than you actually got to spend with your physician. So kudos to you for putting care before insurance companies. There's so much to talk about in this space, but I do want to mention that here in just our local state of Wisconsin, Delta Dental just bought out the Cherry Tree Dental Company with 3 operating dental clinics. We also have insurance companies that are buying other clinics. So Medica or Dean Health Plan just bought out Wisconsin Dean Health Plan, which was owned by SSM Health. Ascension and United Healthcare just recently came to an agreement, and with Wisconsin hospitals, Aspirus Health and Ascension Health acquired 7 hospitals, 21 physician clinics in North and Central Wisconsin from Ascension, Wisconsin, and the Moline Healthcare and Humana, 2 Medicaid managed care organizations, acquired My Choice Wisconsin and by Molina, and Inclusa was acquired by iCare. So as insurance companies are now buying clinics and hospitals, as a consumer, this has me very concerned, because now we have insurance companies that are going to know everything about us as patients, and we're being already conditioned to receive health care like we were and paying all of these additional expenses. So what is your thoughts about what's happening?
It's incredibly dangerous. There was actually a memo at an upper level of one of those institutions. I'm not going to mention which one to avoid the downstream problems, but it's called the castle and moat way of doing things. So what that means is if I have a Aspirus health plan and I want to go to an Aspirus facility, they will let me in. Or if I have a Dean health plan and I control all of the clinics that are associated with that health insurance, I can do that. But if you are an independent surgeon and you want to come into the hospital that was, built by the community to do your work, the insurance plan now says you can't charge what you would normally charge to do this. You have to charge what we want to charge. And so what does that do to the free market? It's going to make costs go skyrocketing, right? That's one thing that'll happen. Mm-hmm. Another thing that you see in real time happening that I've experienced and my colleagues in Madison have experienced is that, hey, I have a person that needs to see a rheumatologist. I'm going to refer them to a rheumatologist. Well, do they have Dean insurance because they can't come see our Dean physicians? Do they have Quartz insurance? Do they have whatever insurance? And based on their insurance, you can't choose the doctor that you want to go to. You can't choose the doctor who can see you the soonest or the one you've heard the best about. You have to go to the doctor that the insurance tells you to go to that is within the plan. Now, they say this is about cost savings, but it's absolutely not. It is about control. I want to make sure that that's very clear. So one example that I had of this was I had a kid that I diagnosed with type 1 diabetes, which is different than type 2. It's an autoimmune condition, and you can crash and need to go to the ICU at any moment once you get diagnosed with this. And I said, okay, I have all the antibodies. This is obvious from all the blood testing that this person needs to be seen by pediatric endocrinology. So the only place where you can really get that is at UW, where they have that type of specialized pediatric autoimmune type care. So the Dean health plan said, no, we're not sending them to UW. You have to go within the system. But they didn't have a pediatric endocrinologist. And they also said, you didn't accept our insurance. So now they have to delay care further, and they have to go find someone who's in our system and find a primary care person who has an appointment available, and they have to diagnose it, even though and it was a PA that they went to, and you as a physician who has diagnosed this, it was like, dude, this kid could go to the ICU while we're dealing with all this. This is ridiculous, but that's what it looks like when you have this vertical integration of the insurance owns the clinics and they tell you who you can go to and how to do care, instead of, as we started today talking about, the doctors and the patients, the people actually involved in care are driving the car, right? So yes, I would say that is terrifying as far as all these vertical integrations. And it is highly needed for the physicians to come out of the woodwork and kind of take back the reins and say, no, this isn't how we do things. We're not beholden to what the insurance company decides is best for their pocketbooks. We're going to do what's best for our patients.
I had a very personal experience that I can speak to regarding insurance coverage, and it had to do with a kidney surgery that my physician felt I needed, that I wanted to have done because of all the risks that were behind it, but the insurance company would not approve my procedure. Or if they would approve my procedure, they were only going to pay a very small amount of that cost. And that's when my outrage began with insurance companies. Is I was so busy in my own world, I didn't really realize all that was going on with this. I mean, I had heard things, but until you really had the experience, such as this, being the parent of that child and being in that situation, I would just be madly outraged and upset, understandably. But that's when I really realized, or it really clicked for me, that we really have a broken system, and that how I was going to get healthcare, I really had to, for the first time, really advocate for myself and my healthcare and what I needed as a patient. And I began to become acutely aware. I started asking questions of people around me and finding there was a lot of people, just like you mentioned, that are having trouble getting the healthcare that they need, they want. And I'm hearing more and more of these clinics, like you have opened up, are opening up all throughout the country. So it appears as consumers, we're becoming more aware of how broken the system is, and we're seeking out alternative medical treatment. So thank you for opening this clinic in our little town here. It's so needed, and I let everybody know that you're here, and I know how busy you are already serving the needs of people. But what's concerning about all this is it's just going from already bad, and it's not going to get any better if I'm looking at all of these facts anytime soon. Would you agree? I mean, what are we in for as consumers?
Absolutely. It seems like there's kind of two tracks that things are taking. So insurance-based healthcare, like, again, premiums are increasing again, right? Mm-hmm. And there's the cash-based practice stuff, which has really, it's been going on for like 30 years. A really great introductory thing that you can read is one of the first cash-based surgical centers was in Oklahoma. And when you first think of that, again, with our, we'd kind of talked about this earlier, and I think that it's important to talk about that anchoring bias, to kind of put some of this into perspective and to get rid of that bias in the listeners. So what anchoring bias is that if something is put into your framework, we have things called heuristics. Heuristics are shortcuts that our brain takes that are part of our decision-making process that we don't realize are there. Normally, they keep us safe, but sometimes they can make it so that the decisions we're making aren't very logical, right? So what the anchoring bias particularly is the research study that was done was that people would spin a spinny thing, and it would either land on 10 or 60, like a random number, and then they would ask them a numbers-based question. So the question that they asked was, how many countries in Africa are in the European Union? So something that someone wouldn't know offhand typically, right? And then people would guess closest to that number that they spun at the beginning of the question, even though it had nothing to do with the question, right? And so what that means is that what we're used to, we start basing everything off of what we're used to, even if what we're used to isn't great, right? This can be seen for, like, this is one of the reasons using like a more sad example, when people are in abusive relationships, when they're younger, they're going to end up choosing it. Why would you do that? Well, your heuristics are based for that, where you're going to end up choosing an abusive relationship because that's what you grew up with and that's what you're used to and that's how your brain works. So with insurance-based care at this point, we think, well, this is just how it is. I have to have insurance, right? So if someone says cash-based surgery, you're like, well, I could never do that, right? So when they opened, the story that they tell is that they first of all, they had a lot of trouble opening, right? Because no hospital wants someone opening up who can do things at a fraction of the cost, because then they lose their hold, right? So they had to go through loops that they had to jump through with legal things and making sure that someone was on their side in the Congress of the state and things like that to open to begin with. So then they opened. And then he said, I had someone call my office and she's like, I need a breast tumor removed. And they're telling me it's going to be $19,000 to get this breast tumor removed and I don't have insurance. What do I do? And he's like, well, let me call the pathologist and figure out how much this is going to be. And he calls her back and it's going to be, and he's like, I think it's going to be like between $2,000 and $3,000 for us to do the surgery, get this breast tumor removed, do all the pathology, do all the care that's needed. And she's like, what part of the care is that? And that's everything. And she's like, but they said it'd be $19,000. How can you do it so much cheaper, right? And so this is the whole, and it is just like, couldn't believe it. And so they opened, and they have people coming from Canada for this surgical center, because they have huge wait times up there. Sometimes they have people coming from all over the country to get everything done, from open heart surgery to, joint replacements, things like that. And they were the first one in the country. And now there's ones sprouting up all over. There's one like Solstice Health is the one that we have here. I can send people there for $1,600 for a colonoscopy, including the pathology. Meanwhile, if you go to a hospital, it could be anywhere between $3,000 and $10,000. You don't know until afterwards, because each thing that they do is going to be another charge, and the whole bill now, ask questions later, and then you get a bill 6 months later and 9 months later and 12 months later for this thing that you're kind of reeling from with the obfuscation and pricing, right? So your original question, I did go off a little bit track. Your original question was, what are consumers to expect in the future? And so the way that I'm seeing it, we need to get rid of that anchoring bias that insurance is always the way to go and the only way, because if you think that insurance is the only way you're going to get things done, you're going to be hammered is basically what it is. And the businesses that are doing more of this direct primary care, which that would be a whole other topic to go into, is how there are places where insurance costs have not risen in 10 years, right? And they're all doing these things where they're working with clinics like mine to make sure that 90% of the care, which is primary care, is going to remain at cost, instead of having that, and then your premium jumps again, and then your premium jumps again, and then your premium jumps again type of a scenario. You could even go into the fact that wages really haven't increased, despite the fact the cost of living has gone up. Well, where is all your money going for your wages? It's going to your employer paying that increased insurance cost, right? So it's like, healthcare is such a huge sector that if it's not functioning, there's a lot of things that aren't going to be functioning, right?
I totally agree that we have been conditioned, and I can see it in myself that I was conditioned. And after going through all this experience and then exploring your working with your clinic, I started really to look at this and actually put a pen to paper and just do basic math. Because you think in your head, well, I can't possibly afford to pay privately for everything. But when I actually wrote down the numbers for my husband and I, what we were paying for insurance, what our deductible was, what we paid of the deductible. So we've been fairly healthy. So we paid for all of our medical care every year anyway, plus the insurance, because everything applied pretty much to our deductible. And so we added that number up, and we're like, this is kind of crazy how much we're paying. Mm-hmm. And then you don't even get the care that you really want. You don't get to spend time like we get to spend when we visit your clinic. We've learned now how great it is to make this decision. But you think in your head that you can't do this. And what we discovered is we switched from our employer health plan, and we decided we're going to go another option. And we basically went to a catastrophe type insurance that would cover us in the event that we have to have surgery, we get a cancer diagnosis, we're hospitalized, and then we took a really high deductible, and we're just going to pay for everything else. And what we learned is that going this way has saved us literally thousands of dollars a year. Now, somebody's going to say, oh, yeah, but then what's your coverage going to be like? Again, we do have coverage. If we have a major hospitalization, we're covered for that.
And I recommend people do that just exactly for being used that way.
But the quality of care that we're getting.
We're Talking About It is brought to you by Our House Senior Living. Visit us at ourhouseseniorliving.com.
By going this route I can't stress to the consumer. Now, everybody needs to go have their own experience. But our experience has been, my husband came home from his first appointment with you, and he's just like, wow, I see now what you mean. Because he thought, oh, I'm being dramatic and over the top. He's like, I don't even have words. He's like, I talked about everything, he said. He's like, there was a couple of times it was even uncomfortable. Like, I haven't been asked so many questions about his health. And not that you were uncomfortable, but he's like, I had to describe the shape of my poop. He's like, I was not ready for that.
Everybody gets asked about their poop, that's for sure.
And he's like, he was just so impressed by how thorough it was. And the fact that we're not just treating symptoms, we're actually trying to figure out what's going on with us and just get to a healthier place. And I think as consumers, everybody wants that. Mm-hmm. And how many times you get 10 minutes with your doctor and you get out your car and like, oh, I didn't get to ask this or that. And you getting back in front of them is such a challenge. Or now you're trying to message or, whatever that looks like. So I just want to impress on people that are out there thinking that they can't afford healthcare this way to really try to think of it differently. We have been conditioned to think that we have to receive healthcare a certain way. There's also that imaging place in Madison I had to go to. Mm-hmm. So I'd like to share a little story about that.
Yeah, definitely.
Because I originally thought, okay, I have to have an image done and I'm going to have to go locally to have that done because this is what I thought, that you have to go to the hospital to do this and because this is what I've been conditioned to think. And so I called over there. I said, well, how much is this going to be? And they said, well, with your insurance, it would be $3,000. And I'm thinking, okay, that would go towards the deductible. And then I said to them, well, what if I don't have insurance at all? Well, if you don't have insurance at all, it's $1,900. So then I'm thinking, okay, I'd be better off now telling them that I don't have insurance at all. And then I'd only have to pay $1,900. Then I talked to you and you're like, well, there's a place down in Madison you could go to, which I was totally oblivious to, didn't know about it. And now I've been telling everybody.
And there's actually two options because of this infrastructure we're creating. You can go to MH Imaging or you could go to ScanSmart, and they're both in Middleton, right?
Oh, perfect.
Yeah.
So the story goes like this. I called down there and that same image was $375 with the radiologist reading. I was shocked, just like I couldn't even grasp that you could get something that reasonable as a consumer. And
honestly, I like working better with them. So Malcolm Hatfield is the reading radiologist at MH Imaging, and he's like a fellow of the American Academy of Radiology. Only 10% of radiologists get that. If I have a question, I can call him on his cell phone and have real communication, right? And so I can't do that with any of the radiologists at any of the hospital systems, right? And I can say, hey, I actually had this other image I wanted you to compare it to, and we can like talk about it, right? And then if I've done that in the hospital, they're like, no, we won't look at another image. I don't get paid for that. It's just like this ridiculous thing where it's like, this is so much less money and it's such better. Like as far as like, I want to say like, and I do want to be very careful here because it's like, we really have to look at the systems here, right? Like, and I'd like to talk about even my own experience of like what it's like trying to practice this way in the insurance-based system and what it's like trying to practice this way when you don't have insurance telling you what to do. Because I want to be very careful about this fact that like all of our radiologists are amazing,
yes.
But as far as him being able to run his own business and run it the way he'd like to, as opposed to what happens when you're, locked within the walls of the system, that's really the difference.
Absolutely. Mm-hmm. And the other thing I want to mention about that is I was on their website and while I was making my own appointment, and you don't even need a doctor's order if you want to go down, and they offer a lot of services. If you want to have a cardiac scoring done or an echocardiogram, you can just go get it done as a routine. And I also seen that they also do a lung, I think if you're at high risk for potential lung cancer, you can go down there and have an annual screen done too.
Yeah, like the low-dose CT screening that's recommended for people who have had smoking history.
Thank you. As the doctor, she knows what she's talking about. So I'm sitting in the waiting room because then a few weeks later, I took my neighbor down there because I told her about this place, and I'm sitting there reading about and still just amazed at the options we have as consumers. And I'm thinking to myself, people need to know about this, that there's so many other options to get your health care and quality options. These are not some fly-by-night places. I mean, very professional. The whole experience there was top-notch. The clinic's beautiful. Mm-hmm. So there's also these notions that if you're going to some discount clinic, it's like in an dark alleyway, and there's a secret knock to get in. That's not the case at all.
Right.
Like I walk in and I didn't know what to expect. This is totally different. again, we've been programmed to receive healthcare a certain way. And I'm just like, it's so enlightening I just can't get behind it enough.
The imaging is one. I would say like sleep studies are another one. Like I think that those normally cost, like everything costs like somewhere between $1,800 and $2,000 and is a 3-month wait. I can get a sleep study out of a company. There's a couple companies out of Florida where I can get it for $189. There's like Sleep Doctor, Lofta, and I can get it done that week if I order it, right? And rather than like waiting a couple months and having people develop some other condition because they have undiagnosed sleep apnea. And I've had people come in and like we'll have this conversation regularly where someone's like, well, they won't let me get the sleep study until it gets this bad. And then I'm like, just get the sleep study done now because as the doctor and patient have decided it's the best thing to do and it's going to cost less money. It's going, you can get it done right now. And people are just in disbelief that it's like, wait, this is how it works. Like, yes, this is how it works. Just, let go of those insurance is everything ideas because we've been conditioned to think that's the way to go.
So I might be getting ahead a little bit from people that are following this. So if they make an appointment and they come in to see you, what does that look like? Because I've already had the experience, so I'm talking about these things. But they make an appointment, they come in and see you. What is that first appointment like? And then how do the labs work also?
So normally when people come in, we want to get all of their medical history up to that point. So we have an authorization to transfer records, and then we do something called a multi-symptom questionnaire, which is let's review every single system. And, kind of like what you're talking about with your husband, where it was like, okay, so we want to know, do you have itchy ears? Do you get headaches? Do you, what's every symptom that you've had? Because we're going to use all those systems and put them together. With the extra time that we get being able to do systems biology, what that means is if someone comes in and they say, I have seasonal allergies, right? If you're in that system that promotes, a bill and a code and does insurance approve this, you're going to naturally say, okay, you have seasonal allergies. Here's an antihistamine like Benadryl or Allegra, and then let's move on, right? But why I need that multi-symptom questionnaire is because what I will say is, okay, so you have seasonal allergies and, hey, with that sleep apnea piece, do you breathe through your mouth at night? Because that will make it so that you can't drain your sinuses properly and increase your risk of having seasonal allergies. So I don't want to just know if you have seasonal allergies. I also want to know if you snore. I also want to know if you have gut trouble, because if you have gut trouble, 70 to 80% of your immune regulatory cells line your gut, right? So we may want to get that sorted out in order to possibly relieve or reduce allergies. I may want to give you a probiotic, particularly lactobacillus species. Lactobacillus plantarum rhamnosus and salviarii are 3 types of gut bacteria that will reduce histamine, right? So instead of taking an antihistamine drug, I'm improving your gut microbiome. Those species are also important for proper acidification in your stomach. And you might get dysbiosis because you don't have these acid-producing things in your stomach, right? And so then I may look at, right? And so it's like I have this whole, I want to make sure we bring all these systems together because stuff that seems unrelated to you may be very related to me, right? And so then we can go through all that. How does the anatomy play into this? How does the physiology play into this? How do all these systems interact to look at whole person health as opposed to, well, now I can bill a 99213 or a 99214 based on how many things that we've discussed, right? And if you're forced to think that way, if you're forced to think like, okay, I get this much time and I have this billing code that I can do, right? Then you're going to not be able to think systems biology. The way that people normally get healthcare is like that whole Band-Aid solution thing, right? And there's many physicians who would like to have that discussion. And then it's like, I remember in the system, I wanted to refer to nutritionists a lot, right? One of the things that I did to help when I was in the system is I created a blog. Like even when I was in my residency training, I was already noticing the burn of I don't have enough to not only do you have to talk to people, but it's like people need the resources, right? People are busy. How do they work this stuff into their daily life with their kids and their jobs and everything else? And now you're asking them to change their health. So I created a blog at that point being like, all right, here's, if you do cowboy caviar, all that is you take some salsa and some beans and some cumin, and that's a filling for tacos that you can do in 5 minutes, right? So I was already doing that stuff. But if I wanted to do an actual nutritionist referral, that's like $500 an hour, unless you already have diabetes, right? And then if you already have diabetes, you get one, nutritionist thing that's paid for, and that's it, right? So it's like, how are you supposed to, in the system, work with this? Now I have actual like classes that I'll send people, and I have, comprehensive, food plans that I can give diet prescriptions. So it's like, okay, you want to reduce your hypertension, diabetes, all of your things. Well, let's do a cardiometabolic plan. And here's an actual video series. And here's your, recipe book. And here's all these things that we can troubleshoot at each visit, right? So the system that I have now is based on how do we reverse this or fix this? Whereas if you're in the other system, try to do nutrition counseling before people get diabetes. It's not going to happen, and you're right with the whole, it's only getting worse as far as what's covered, how much things cost, what I call the monopoly money system of that type of thing. Now let's move on to lab work, right? So your typical labs that you're going to get for your yearly physical are going to be a lipid panel and a complete metabolic panel if you're lucky, right? And that's going to be, $300 for each of those labs, maybe $600.
If you're lucky.
Right.
Because my last wellness visit before I came to see you, I didn't even get any of the labs ordered, which I was kind of shocked by because I'm over 50 now.
Mm-hmm.
Don't tell anybody how old I am. But I'm over 50 now. And I was kind of shocked by that. But I came to you, not to interrupt. Yeah. And I was blown away how many labs you did.
Right.
Just learn to be. And I thought, wow, this is amazing. A doctor that can be a doctor.
Mm-hmm.
So go ahead.
Right, exactly. And I've had experiences like that. I call it PTSD from the system, where someone is like, someone in my family has Hashimoto's. I'm wondering if I have Hashimoto's. Can you order thyroid antibody testing? And I'm like, no, I can't. Insurance will cover them. I'm like, I don't have insurance. Why am I thinking that? Because I can order thyroid peroxidase antibody. It's like $8, for me to order that test. It's, and I don't have to make that, is insurance going to cover that as part of my decision-making process, right? So as far as the yearly lab panel that we do screen for thyroid yearly, because why not? Because we don't want people to come in when they've, gained 20 pounds and are having depression and things and wonder if that's the case. It's like, well, what's your yearly labs? Apolipoprotein B is a much better cardiovascular risk predictor than your lipid panel alone, because you only find it on the bad cholesterol and the ones that are going to actually be the ones that get into the endothelial lining and cause heart disease, right? So if you have your normal lipid panel, it does tell you total cholesterol. And I do get the normal lipid panel. I like it. It has HDL, things like that. But I'm always going to get an apolipoprotein B, because I can say, okay, if it's at 90, you're at the 50th percentile risk for the entire population. And the lower we get it, the lower your risk, the higher it is, the higher your risk. And that gives more context to your lipid panel, right? And so and then I'll order vitamin D, because we live in Wisconsin. I think anyone at this latitude needs to have vitamin D checked. Like, that seems silly to me not to, whenever we have a vitamin D receptor on every cell in our bodies, right? So why would I not want to know that when it's associated with, your osteoporosis risk? And I shouldn't just be worrying about that when you're 65 and the only thing left is a drug. I should be worrying about that when you're 25, and that's when your bone density is the highest. I don't want you to be having low vitamin D when you're building up your bone density to the highest it's going to be your whole life, and then kind of, tanks from there, right? So it's just, just a lot more things I can do. Oh, and that's like, I can get both forms of vitamin D. I can get the storage form, which is an $8 test, and I can get the serum form, which is a $10 test, right? So it's like, whereas going to the system, I don't know, anywhere between $150 and $400, right, for a test like that. And the insurance isn't going to cover it, right? So like, again and again, I feel like I could just write a textbook on, yes, just your yearly lab panel as far as what I'm able to do outside of the system versus what I'm forced to do in the system. And then you think also, why would I even learn about it if I'm in the system? Why would I learn about apolipoprotein B and that there's 20 years of research showing that it's a better cardiovascular? If I can't order the test, what's the point in me spending the time learning about these things, right? And this is one of the reasons why, it's like, oh, we learned something and then it takes 17 years to hit general medical practice. Well, you have to, not only show it in actual research, you have to make insurance approve it and, have your hospital say it's okay, all these types of things to try to get it into. It really puts us back as far as moving medicine forward if the decision maker is the insurance company and not the doctors and the patients in your care.
Yeah. Incredible. When we did the whole labs, my experience, and I was like, and then when we met and we went through it all, again, mind blown. Like it is, you really get to see the whole picture. And I went home and said to my husband again, I'm like, I can't believe we're not doing medicine like this, because it's so clear as a consumer. You're the expert, right? But it's so clear to me as the consumer that this is such a better way.
Mm-hmm.
But we have been constrained by insurance companies.
Mm-hmm.
And
I think there's two parts to that. Yes, there's insurance companies, and there's the whole thing where, insurance is never losing money no matter what the rest of the economy is doing, right?
Mm-hmm.
We might be, but insurance is not. So there is that. But I also think it's important to state, why is it so high priced to begin with? Why are these tests, 10, 15, 20 times in the hospital what they are in my clinic? And so there might not. And so the story that's told about that is the following, is that as far as collusion goes, if you're an insurance company and your patient spends more money that year, well, you've got to raise premiums, right? So the higher the cost of care, that's not too bad for insurance companies. Also, if we have these monopoly money things and the hospital says, well, I'm going to make this test $600, and well, now that you have insurance, it's $300. It's like, well, none of that is real money, right? But the insurance is like, well, look how much I saved you. I saved you 50% on your monopoly money cost, right? So it's like they can kind of work together to make these costs ridiculous, whereas if you're paying cash and I have to look you in the eye when you come into my clinic and say, hey, this is how much care costs, you don't get to have like all this weird obfuscation and mirror rooms and smoke and mirrors going on to say, how much does your healthcare actually cost? There's a reason for things, and you have to explain that reason, explain your costs, then somehow that's going to keep the costs in real life instead of, what you experience in the insurance-based system.
so how do you so I get my medication now through you.
Mm-hmm.
How do you do that? Out of like, that's a whole new concept too, because I always used to think, I've been conditioned to think I have to go to a pharmacy to get my medicine.
Mm-hmm.
So with you, you're like, oh, that's one of the perks. I can get it for you right here. And I'm like, oh, this is amazing.
Right.
Again,
So then
mind blown.
Mm-hmm.
So how does that work?
Visit, and you don't have to stand in a pharmacy line, and you can just pick up your meds and then go on your way, right? So I just order those at cost, and then I add 10% for, the cost of the, credit card that might be used, or the bottles that I put it in, or whatever. So pretty much still at cost, right? And then I have a panel of drugs that I have in my clinic that I then just, sell to the patient at cost instead of having to go through insurance. Now, a side piece about pharmacy benefit managers, and the Hometown Pharmacy Group has actually been really helpful as far as trying to help with these things.
Mm-hmm.
So sometimes you'll go to the pharmacy and your medication is actually more expensive with insurance than it would be without insurance, right? And there used to be an actual gag rule where if the pharmacist told you of this cost difference, like they would be putting themselves at risk and they could suffer consequences from that. And so the Hometown Pharmacy Group actually introduced a law to make it so that pharmacists could be truthful with you about this is actually less expensive without your insurance, which is nuts, that a pharmacy group had to do that. And then there's also the problem of like, so you're always kind of like having to juggle. You almost need an advocate. And that's one of like, you need an advocate in the system to be like, this is how much things actually cost because of those smoke and mirrors games associated with medications, with all those things we've previously talked about. But yeah, that's basically what we do is we just sell things at cost. We have labs at cost. We have medications at cost, because what we're really caring about is the doctor-patient relationship and the decision-making process, not all these ancillary things. Those are just vehicles to help the main thing that we care about exist.
I do want to point out at your clinic, you also have a lot of natural, what do I want to say, options.
Supplements, botanicals, nutraceuticals, yes. Things like this.
Yes. And so you have a perspective. What is your perspective on natural medicine?
I think the ideal would be to need nothing, to just have your body work as it should and not need any support. I think the next best thing would be to use nutrition as medicine, use food as medicine, right? But sometimes you can get that stuff in better stead through supplements. So let's take the example of cruciferous vegetables. Cruciferous vegetables are sulfur-containing vegetables, and if you have one daily serving per day, you will decrease your cancer risk. That's so obvious that even the National Cancer Institute, more of an allopathic institution, has recommended, hey, everyone should have a daily serving of cruciferous vegetables. Those sulfury vegetables tend to have that sulfury bite. So that would be cauliflower, broccoli, Brussels sprouts, cabbage. Bok choy is one of them, even though it is not as strongly flavored. Radishes, horseradish, arugula. There's a bunch of things that are considered cruciferous vegetables, right? And they have tons of health benefits. Now, if you take diethyldolamine, which is an extract from that, and you super concentrate it, you can actually get other things that happen, like better estrogen metabolism. So like there's the estrogen, like the 4-OH variety that causes cancer, and then there's the 2-OH variety that has all the health benefits that we like. You can promote the metabolism of the good estrogen if you use it at a 300 milligram dosage, right? So that would be an example of I'm using, yes, I'd like to use food first, but if someone is having problems with estrogen metabolism, I might use a supplement for that, right? Especially in, say, the perimenopausal time period, right? Or, food, we have 30% less nutrients in the soil now than we did 100 years ago because of the farming practices where a lot of our topsoil is in the Gulf of Mexico at this point. So it's like, well, it's kind of hard to get around using a multivitamin at this point, right? So then I have high quality multivitamins. The other thing about supplements is that the quality can be all over the board, right? And so people will bring in like, I got this supplement from there and this supplement from there and this supplement from there. And it's like, I don't have time to review 100 different supplements every day to do a really good review of them. So normally I'll just say, I have something that works that I'm giving you at the lowest possible selling point that the manufacturer allows me to sell it at. So everyone gets a 20% discount on top tier supplements out of the office. So then that kind of solves that problem for me where I'm like, I know this works. I've seen it have results in patients. I know how to use these things. If you want to get supplements from anywhere else, that's awesome. I will give you a sheet that teaches you how to, vet your supplements and make sure that they're not, that they have certified good manufacturing practices. And it's not just, you got advertised this on Facebook or whatever. And now, you're taking it because of the advertising, right? But it allows me to like do that where it's like, all right, I know how these products work and I can use those there's a whole level of training that you go through to be able to use them well as well,
Well, I appreciated the fact that it's in your office and that you have done the research because that's just it. Just like you said, there are thousands of supplements. I mean, if you get on Amazon and try to look up a supplement, there's just like what's good, what's bad, where'd this come from, and do all that research. And the fact that you just have it there and I can look on there and be like, oh, which one is good for sleep? I think that was my question. And right away, you're like, oh, try this one. And I know that you have vetted it already, so to speak.
Right.
You've done the research.
Yeah.
To me as the consumer, thank goodness. Like, I know that I'm getting something.
And it's something that we're
office.
not making money off of. It's like what I need to do is I need to get results for people, right? Like that's the whole point of my business is, you came because you heard good things, right? And that's how my business works is if people aren't getting results, like they're paying cash to come. No one's forcing them to come, right? And so I have all these things but it's like really it's just to get people results. It's not to, to make money off of it. And then the getting results is what we care about.
So how to belong to your clinic, there's a membership process. Walk me through that.
So if people come in for acute office visits, that's what leads to I've got to push in as many people as I can per day. I'm not going to be able to spend 2 hours with you for your first visit. I'm not going to be able to say, hey, let's do the absolute best thing for you. If I have a membership, then sometimes people are going to come in and sometimes they're not. But either way, they're supporting the health of the entire community, kind of like a co-op, right? So there's a sign-on fee of $150, and then there is 2 tiers that people can do. So if people are going to be like basically like I want to get all these things fixed, and using all of the cognitive load and the knowledge base, there's a functional medicine tier that runs at $200 per month, which is pretty bottom of the barrel for what functional medicine charges, but it allows us to really like get all that stuff in place. If people are coming in and they're like, I've basically got all my health under control. I'm not really looking to change too much, but I just want to be able to, go to who I want to go to as a doctor and have this advocate in this crazy healthcare world to make sure I'm getting the best value for my cost and things like that. And that's basically what we're doing, not really focusing on solving all these different problems and pulling all the body systems together. That would be the direct primary care tier. And that one is $80 a month to do. And then you just pay that $80 a month. So it's, less than the ER visit that you're going to avoid per year, less than $1,000 per year, as opposed to, like $3,000 to go to the ER to get a swab for, an upper respiratory tract infection. And,
it's less than my subscription television channels list that I pay
exactly
for, and so to have access to you, well worth it, for sure. Let's see. We've got through a lot of our questions. Can people with insurance come to you?
Yes. People with insurance can come to me, and no matter what their insurance is. And if they have a PPO, sometimes they can submit to insurance to do that. Everyone can use their HSA FSA dollars. That was a federal law that was passed in the summer that HSA FSA dollars, they must pay for the membership subscription fees and things that happen in the office. We don't mess with insurance because that would drive our costs through the roof, right? Because we'd have all the red tape and do they want to pay for this? And we just discussed, ad nauseum why we don't accept insurance, right? But it doesn't prohibit anyone from coming to us if they have insurance. Sometimes people will come just to get the care type that they get, where they get a little bit more as far as the holistic care, or, they just want to get more from that aspect of it. Sometimes people come because they have insurance, and I do recommend everyone have disaster plans at least, but, the cost for primary care is skyrocketing, and they would, it's a cost savings to come. So there's a lot of reasons to come if you have insurance. And I do recommend that people have those wraparound plans like you have in case of disaster, because, we are in an ER. I can't treat a heart attack. I can't treat a stroke. I can't treat cancer, things like this.
Sure. And if people want to just come in for maybe a couple of visits, is that an option too?
We do have an acute visit where it's $200 to come in for an acute visit. And then that is the ability to do that is going to depend on the membership-based practice. So as we've been kind of exploding this year, we've been talking about that. So I don't want to say that option is going to be there forever as far as the acute visit, but it currently does exist where if someone wants to come in just for, like a consult, that's a $200 charge.
So you said you're exploding this year. So this is really catching on with people.
Yes. As the premiums increased, people have been turning to the clinic even more in the new year. And we kind of have a wait list going that has started as far as getting that on board.
What if it's a family with kids? Are there family plans that they can join under, or is that a per person plan?
So kids will get a reduced cost if they sign up with a parent. Okay. Just because, yes, for, if you're a parent, you're paying for kids, we try to allow for that as far as making sure that there's a reduced cost for children, that a parent is also paying for.
Okay. Well, it sounds like there are tons and tons of options.
Mm-hmm. But yeah, it's really just as simple as go on the website, fill out the contact form. So it's clarkcaredpc.com. You can access that through, the actual website. And then I think I have it on my Facebook too. And then front desk staff will take you through all of those, fill out this paperwork, fill out this form to get your chart set up in the medical record. Let's get all this stuff taken care of, and they'll set you up with your, initiation first visit. And then once you've had your first visit, you can, we have texting options, we have call options. You can call me directly if it's something that you need to really, get taken care of, right away type of a thing. So we try to make it so it's easy for people to access and get their stuff taken care of within 24 hours of contact.
Great. Well, thank you so much for coming in and sharing what you do. I think it's such important work in our community. And talking with us today, and hopefully the viewers are getting a whole new outlook on what options they have. So thank you, everyone, for listening today, and to our healthcare heroes that make it all possible. Thank you. And for information on Clark Hair, visit clarkhairdpc.com. I'm Angie Graham, and this is the Angie Graham Podcast.